with Joe, episode number what, 3? I think this is episode number 3. So here's what we're going to talk about today. Now, on my video I posted last night, um, I talked about the horrors of physical therapy and like literally 3 different scenarios where if you're in those scenarios, you want to get out. So let's go ahead and talk about a horror story I had here. Now, obviously, I can't name any names or anything that might affect personal or professional or patient confidentiality. So we're gonna I'm gonna be tiptoeing around, making sure that uh, I don't get in trouble. But here is a scenario that happened 15 years ago, probably. So here we go. So I'm an outpatient, right? Outpatient physical therapist, and this happened to one of the other clinicians. And so we're in there. That sun's really beating on my face a bit here. So sorry about that. So I'm out there, right, seeing a patient, and I hear this in the back of the room. I hear this, bam! I'm like, what the heck? I'm thinking a patient fell. That's the first thing I'm thinking about. A patient fell. Now we got to go ahead and triage it. That isn't what happened. So the curtain's closed, and so obviously, since the curtain's closed, confidentiality, I'm not going to break that. So afterwards, staff says to me, the other clinician comes up to me, wants a little advice of what to do, because I've been a clinician for probably 5 or 6 years at that point, and obviously longer, having a lot of outpatient experience at that time. And so she comes up to me in confidentiality, trying to get just some professional advice. So this patient literally had sunglasses on the whole time. Whole time they're there. Now this is in an outpatient environment, so they're wearing sunglasses indoors the whole time they're there, pretending that they can't see. There's no history, no diagnosis of you know blindness or anything that would warrant needing sunglasses inside. And apparently, that big bang was this patient kicking the filing cabinet. Apparently, they got upset. I don't know, question they might have been asked. And so they popped up out of the chair and went over and kicked the filing cabinet. So that was the noise I heard, was this bam, a filing cabinet. Now they were there for apparently some sort of spine pain. And afterwards, if someone could pop right up out of a chair and go over and kick, in this case, our filing cabinet, I'm not sure they were hurting that bad. So obviously there were some other issues going on with this patient. Uh, besides spinal issues, this person was having issues, probably behavioral health. And back then, behavioral health wasn't at the forefront like it is today. It was still taboo. Yeah, it is a little bit today, but nothing like it was back then. And so, so that's a horror story for you right there. You just never know what happens when the public comes in to be treated for something and what's unveiled while you're completing an evaluation. So right there, that's a horror story for you. Another one here. This one's off the chain. So this was 23 years ago, probably somewhere around there. I'm working in Maryland at the time, and we're evaluating this person. Now, the place I worked at was mainly, workman's comp, car accidents, chronic patients, stuff like that. That's the kind of give you a backdrop of the type of patients that we're seeing back then. This is the mid to late 1990s. So I'm like trying to figure this patient out. Well, needless to say, they were one of my first experiences working with was a transvestite. And so I'm seeing this person. No big issue. I could care what sexual orientation you are. But I'm there going to evaluate the person. And they're lying on their stomach. And, you know, let's backdrop to this. I had previously was telling them to put on a gown, make sure to keep their underwear on, their undergarments on, because I'm going to need to look at their spine, because I'm going to treat their spine. So I said, go ahead, lie on your stomach, and, when you tell me to, I'll come in and, and so I prep them appropriately. So they're like, oh, what do you think of my back tattoo? I'm like, I didn't even had a chance to really look at the entire spine yet. I'm like, oh, okay, I guess all right. And so as I totally see what the heck this is, it's a tattoo. And needless to say, it was of a oops, sorry about that. That sounds really killing me on the side. So it's of a naked person. Yeah, tattoo of a naked person on someone else's back. So you just never know what you're going to experience in the physical therapy environment. So there's a horror story right there. I had been out of school maybe, I don't know, 6, 8 months at that time. And I was like, okay, that's enough. So I treated him and did everything I was supposed to appropriately, and and everything was cordial, and that was the end of that session. But these are just some stories and some experiences you just never think you're gonna get in physical therapy, but you do. So those are two right there. Two of them I can think of at the top of my head. I think I got one more here before I go ahead and sign off here. I might sign on a little bit earlier today. Hopefully, maybe someone will watch this later on to kind of get some ideas of some horror stories in therapy that they never think of. I think I'm going to sneeze because of the seasonal allergies. Yeah. Ooh. Ooh. Mm-mm-mm. No, it's not COVID. That's another whole story. I don't want to get in trouble. Everybody mowed the lawns here, so it's starting to bother me a little bit. Maybe I better take some Flonase. Try and stay away from this stuff as much as I possibly can. All right. Horror story number 3. And this is a good one. Probably the best one I have that I can think of right now. All right. Here it goes. So this is back when I was a student physical therapist. And so we're doing this time we're doing aquatic therapy or pool therapy, however you want to look at it. And you just never know what you're going to walk into when you're in that environment. So you always obviously are very professional from start to finish because the environment can lead itself to, how do I say it, unsettling circumstances. So see the patient, gonna go evaluate them for aquatic therapy, and they say, okay, I just need to go to the bathroom, and like, okay, yeah, go to the bathroom, and we'll go ahead and get started afterwards. So So it's hilarious. Now that I think about it, it's hilarious, but not. You know, things happen with people. You just never know. Hey, alternative tongue, how you doing, sir? Long time no see. Yeah, yeah, yeah. How's it? It's going all right. You know, I figure I'd come on here. What I'm starting to do now is a combination of. Let me just break from what I was going to say for a second, because I got a guy on here that is a fellow YouTuber, but to talk to him for a second. Very nice weather. Yeah, yeah. This is North Carolina. This is the spring of North Carolina, where it's like I don't know, 75. Um, so yeah, blue skies of North Carolina. Um, where was I at? Oh yeah, yeah. So I'm doing a combination of shorts that connect to my videos as well as that connect to my lives. So that's what I'm kind of doing now. So it kind of you can do yeah, I do one content and then kind of tags to all three of those. So, but thanks for jumping on. Um, so what I'm talking about is the horror stories, three of them of physical therapy. One that attaches to my short, which I did a video last night on. Not someone broke their glasses. And then I'm giving three other stories today. So I'm going more into the story realm too, because people like to hear stories more than just instructional content, which is where a lot of my content has been, is more instructional. So I'm kind of blending it story instructional. So we'll see where it leads me. So the third horror story is I'm doing pool therapy with someone, and I go to evaluate them. I'm like, okay, wait, I need to leave. I need to get out for a second. I'm like, okay, okay, if you need to go to the bathroom. So they go to the bathroom, and here I am waiting like 10 minutes, 15 minutes, and thinking to myself, maybe they fell when they were in the bathroom. You know, it's wet, it's cool. So here I am thinking about, oh my heavens, they may be in the bathroom. They might be in the bathroom and might have fallen. So here I am trying to get another female to go in there and find out what the heck's going on with them. So I'm knocking on the door. Are you okay in there? Are you okay? And I don't hear anything. I'm like, what the heck's going on? Still working hard. Well, thank you, alternative tongue. So, so needless to say, I'm in the background, and I'm like, hello, you okay? Anybody in there? And hear nothing. There's nothing's going on, and I'm like, shoot. So I finally get someone from the front desk, a female, to go in there, and they're not even there. I'm like, so here am I. I go back to the pool because I'm trying to figure out, okay, maybe we missed each other. And no, they were gone. They just were gone. I'm like, so here am I. Go ahead. I get a shower, get changed, get back to the department, and try and figure out what the heck's going on. Well, lo and behold, I hear from someone, not a staff member, not an employee, nothing. Someone's like, yeah, they got dressed and just zoomed right out of there. And I was like, what the heck happened? I had no idea. Maybe it's something I said, maybe something. And no, I mean, what had happened was is they accidentally soiled themselves. So they rushed out and they went home and never called or not anything. So several weeks had gone by and come to find out that's how that situation ended. It was quite a strange one. You just don't expect these every once in a while, and it's it's unsettling. But you just working through all these years, you just have these weird stories that come up every once in a blue moon, and that be a few of them where things happen. I've had several patients throughout the years. It's a human bodily thing that people want to talk about, but it happens. You know, especially if you're on certain medications or maybe you have some sort of nerve issue or some sort of central nervous system issue going on. Sometimes it happens where you can't hold your bowels, you can't hold your bladder, and things happen. But so was an emotions and embarrassment, and the reality is they just, you know, didn't give me the chance to try and get things smoothened out. And definitely never want to lose a patient because of something that they, don't want to lose a patient at all, let alone you don't want to lose them because something is, they think is serious, and the reality is as a professional, this is what we deal with day in and day out. You know, sometimes it's tough being the opposite sex and you're evaluating someone or seeing someone of the opposite sex and they just have all these things mulling around in their head and projecting them onto you. And the reality is you're not thinking that way at all. I mean, they have a story that's playing on in their head, and it's not even what's currently happening in the environment. Boy, that can get you in a lot of trouble. So you always want to make sure that there's a guy out riding his bike. It's an old 10-speed bike, I think. So you want to make sure that you're up front. If you're the patient, or I guess they call them clients now. I still call them patients. Say I'm the patient. That's an easy thing to do. I'm only human. I got all kinds of medical problems. First time I had a real medical problem. It was my back. It was a lower back problem. If you're a physical therapist and you're doing this long enough, no matter your technique or whatever, you're gonna bother your back's gonna go out at some point. I mean, I'm a fairly strong guy. I'm active. Father Time catches up to us all, unfortunately. Hi. Father Time catches up to us, and my instance having back problems. That's the reason why a lot of my channel was really focused initially around spine and back problems, because not only do I have the education and the experience, but I'm also a client. I've had the exact same problems as everybody else has with back problems through the years. So I know from both sides of the mirror, you know, being the person receiving as well as giving the treatment, to know exactly how to get things to calm back down and what treatments are effective for certain problems and ones that aren't, and you're just wasting your time. And so I really do hope that comes through on a lot of my videos. But let's get back to the story here. So my first time being out there and having a back problem. I mean, a real back problem. I was working for a company back in Maryland, and at the time, I was actually still a physical therapist assistant. I hadn't got back and got my doctorate degree yet, and so my girlfriend at the time, my fiance, somewhere around in there, we moved to Maryland, and it was my second job. I was down there about a year and a half, about 2 years, I think it was. It was about a year and a half, right? I picked up this box, and it had pieces of a recumbent bike, which is kind of it's a regular stationary bike, but it's got a big seat and it can kind of tilt back and do all these little things. You can Google that if you want. But I lifted this box, and I lifted it. It had a wide stance, and when I lifted that sucker, oh man, through my back, and boom, I felt it right then, where that first time where you get that burning sensation in that. It feels like it's in your sacroiliac joint, but it's really just your facet joint or your disc that gave. I could go into SI joints and how they're really overdiagnosed. SI is really a diagnosis of exclusion, which means you rule everything else out. And if you figured it like there's nothing else in it, it's probably the SI joint, and then you can do some evaluative techniques to really figure out if it truly is or not. I had a whole video on that you could go into and look if you want to. But needless to say, oh man, I ended up icing that thing, doing all the anti-inflammatories, doing all the stomach stuff, and it did calm down, but it was the initial damage, and then as the decades go on, because I was in my early 20s then, you know, and you end up having this bout every once in a while until you figure out, okay, what am I doing wrong? We can start with the mechanical structures of the spine. What am I doing wrong? Oh, sorry, that sun is really kicking. What am I doing wrong? Mechanically wise, lifting, sitting too long, all the things I've talked about on my channel. And then all the holistic stuff. What are techniques I can do, whether it's, how do I reduce my inflammation? Whether it is those mechanical things that perpetuate the inflammation, or is it the things I'm eating that's causing the inflammation, which is darn near everything unless it's freshly grown nowadays. And you really want to look at those pieces as well. And that was my first bout with back problems, where I became the patient instead of, I was the therapist, treating that person. And so you can really overdo it. And what I mean by that is overdo it objectively, assessment wise. It's almost like, don't treat yourself, because you probably think it's the worst thing. And you always need that objective eye besides your own to really figure out truly if you're on the right path or not. And so throughout the years, I've had a couple of my good friends, therapists, look at my back, and I was right. That's basically what it was. But when you're that patient, and sometimes too much knowledge, it's not good either, because then you start mulling things in your head. Oh, it could be this, it could be that. That's the reason why the WebMD and Google a lot of times is not a good thing, because he's trying self-diagnose. If anything's going on for quite a while, and I mean, like, if you're having any kind of symptoms that's not seem to calm down, seems to have all kinds of weird symptoms along with it. Let's just give it a good example here while I got a few people on. Let's just say you think it's a back problem, right? Guess what? Unless you go and see a therapist, or at least go and see a medical doctor, they can screen you out of all the basic systemic things that it could be, like a kidney stone. A lot of things disperse pain into the lower back. It could be something, could be a medication causing muscle or back symptoms. There are plenty of medications that will do that. Statins will do that, give you generalized muscle pain. So if you're on a cholesterol statin, like they put me on, don't even get me started on that. I'll be talking to the doctor at some point about, okay, let's talk a little bit more sensitive, be a little more, not sensitive, but a little more specific on, what's your real rationale for keeping me on something like that. I'll give them for a little bit just because of the situation I had. And if you're curious about that, DM me down below. Maybe I'll do a whole string of podcasts on that, or maybe multiple videos and stories on that. But when you're thinking that it's something simplistic that's going on with you, aches and pains, just be mindful of what I call the red flags. Let's say it's like I said, let's go back to the back scenario. Could be your kidneys, could be medication, could be cancer. Always could be that. I mean, that's the last thing it could be, but depending on where you're at age-wise, it could be. Someone just dropped a little tricycle. When it comes to that lower back issue, if you're having any kind of what we call saddle numbness, and that's any numbness around the pelvic area, around private areas. Man, that sun's killer today. And you're on the private areas. I apologize for that sun. Seems like it's following me wherever I go. That little ball in the sky. But if you're having any of those types of symptoms, those are weak. Those are red flags. Those are you need to go to the emergency room. If you're having bladder where you can't hold your bladder and you're having back symptoms, that's a red flag. You need to definitely see someone immediately. It's not something that's going to go away, and it probably won't. It's probably going to get worse. If you're having back symptoms and both your legs are weak, it's like, what the heck? That's a red flag. You need to go see someone. So anytime you start to have what we call systemic things going on, like internally, bladder, bowel, numbness in the areas that's around the what we call the nether regions. You have any type? You got that's a red alert, red alert right from Star Trek, and you need to definitely go see your physician for those symptoms. So those are some things that you might just brush off, especially if they come and go. If they're coming and going, it means you need to definitely see someone and be mindful of that. But in my instance, with the back problem, as long as you be smart, you ain't gotta run to the surgeon and get cut. Because once you've been, it's kind of like tattoos. Once you have a tattoo, they always say you want to have 10 more tattoos. Once you've been cut, it's classically always easy to go back. Well, not easy, but it seems like instead of going through the proper treatment of another image to being done, or maybe more therapy, or some sort of treatment to reduce your symptoms and let your body heal. Because once you get caught, you're already reducing the likelihood that your body can compensate and heal itself to a point. Most, in this example, I'm referring to back problems. Most times your body, if you give it time to recover and you don't keep beating the crap out of your back and keep putting yourself into the same scenario that caused the problem in the first place, your body will tend to recover. I mean, we're talking even nerve issues. Where on an MRI or an X-ray, it'll show like, holy cow, there's no movement in there at all. You'd be surprised how little movement or space, excuse me, how much little space that your body can compensate for with those nerves coming out. That's the classic case of you see a surgeon and they're like, oh yeah, there's barely any. Well, my symptoms they're not constant all the time. I had a wonderful professor when I went to school. I had a lot of them, but the one I was thinking of is she was our gross anatomy, cadaver, and physiology professor. She was hard. She weeded a lot of people out of that program, but if you got through her gauntlet of fire, you were going to make it just fine. And you remember everything that she taught you. And so one of the things I'm referring to is gross anatomy. And you're in there with the cadavers, and they're showing you all the little spaces where these nerves come out at. And we're looking at elderly people for the most part. There's barely any space in there. And you go to these surgeons, chiropractors are known for this one. Best thing she ever said is, don't ever get cut on unless the three things are going on. One, you can't you're having bowel or bladder issues, or we call incontinence. If you're having that issue and it's coming from your back, you need to have surgery. If you're having saddle numbness, which is what's in the nether regions, if you're having that issue, you need to see a surgeon, because you're gonna need to have surgery. If you're having significant both leg weaknesses where you really can't stand up and you're bent over all the time, okay, you need to see a surgeon. Those are really only a few reasons. Now, I've seen so many surgeries over the year. I'm sorry, that sun's killing you guys. Excuse me. I've seen so many reasons they should have never did surgery on someone. You know, we're talking about people that are in their late 20s and 30s, or even early 20s, and they had spinal surgery, and it's like, yeah, you didn't need to have that, and now you're dealing with a disc that's not even there anymore, and you're dealing with scar tissue. Because guess what? This is what these surgeons don't tell you. The human body, when they take part of a disc out of your spine, what's called a discectomy, and they'll take, and I have this in a bunch of my videos. You can go ahead and look at them, especially on the back. They show, I have a lot of little nice graphs in them, and pictures and videos of the surgery themselves, where they're cutting out that part of the bone to relieve the nerve. Now, once that's done, that's it. Now you've caused instability in that spine to relieve the nerve. And really, to a 20 or 30-year-old, please give me a break. A lot of the times, including myself, if you do the things a physical therapist tells you to do, or even probably, may I say it, holistic chiropractors, your symptoms definitely will go away. You have to give it probably, if you have nerve issues, you're probably looking at somewhere between 2 and 3 months to get your symptoms to calm down from the height where they're the worst. And that's what you need to do, you know, because once you cut that disc away, cut that bone away, and the next, now what happens there is there's space there. And like I said, what they don't tell you, it's scar tissue is going to fill in that spot. That's right. It's not going to stay hollow forever. And that's what happens. Scar tissue gets in there, or now that they've changed the structure of the spine a bit, they've changed the movement by taking some of the bone out. That's going to cause some excessive stress on the bone. And you're going to get what's called osteophytes. And that's little bone growth. And that little bone growth causes inflammation. The inflammation is causing the pain, and you're getting injections, and you're getting this, you're like, oh, maybe I need another surgery. That's right in the same spot as it was before. Well, guess what? What you've gone and done, here you go. Oh, that sun's right in the way. What you've gone and done is change the mechanics of that spine forever the first time you cut into it. So that's my professional opinion and experience. You don't get cut into, not unless it's absolutely if it's absolutely necessary with those 3 things. I'm going to tell you one more horror story before I sign off here, because you poor souls have been on here for 33 minutes already. Thanks for sticking with me. Scoliosis. Back in the early 2000s, it was more times than not, he had surgeons that wanted to fix everybody's scoliosis. And guess what? There's a lot of adaptation that happens. That's a nice word, adaptation, right? There's a lot of adaptation that happens in the spine when you're born with a scoliosis, or you develop a scoliosis as you age. We're talking not only the joint is changed and rotated and twisted, but all the ligaments, all the muscles, all the tendons, all the soft tissue, all the cartilage, they've all adapted as you've grown to those angles of that scoliosis. And guess what happens when you, the surgeon, goes in there and straightens everything out and put hardware in there? You get insane pain and inflammation. So if it ain't broke, don't fix it. Unless you're, in this case, number one is unless you're having a lot of breathing issues, there's a certain angle that your scoliosis has to be, where it's affecting your ribs to be able to open and close. Then you have the surgery. Other than that, people were doing it. You're fine. You're fine. People were doing it just to. I don't know what they were doing it for. Pain management. It was making the pain worse, is what it was doing. So scoliosis, it's a horror, and I had a lot patients back in the early 2000s that they were fixing the scoliosis, and they were having more problems afterwards than they ever were before. So if you guys have any questions, you go ahead and DM me down below. Okay, and hopefully see, hopefully maybe you'll subscribe. That's all right if you don't, but I'd like you to. Makes the channel grow a little bit. All right, until next time. Average Joe here says look up and keep smiling. See you next time, folks.